Congenital mitral stenosis is a rare complex cardiac anomaly characterized by an anatomical obstruction of the left ventricular inflow. Unlike the acquired version often seen in adults with rheumatic heart disease, congenital mitral stenosis is defined by a primary developmental failure of the mitral valve apparatus. Congenital mitral stenosis was divided into four types by Ruckman and Van Praag. Typical congenital mitral stenosis, characterized by thickened leaflets and shortened fused chordae with narrow interchordal spaces. This is the most common variety. Hypoplastic mitral stenosis, a miniature version of a normal valve typically seen in hypoplastic left heart syndrome. Second most common variety, noted in infancy and has never been reported as a de novo diagnosis in adults. Supramitral ring, a fibrous diaphragm just above the mitral annulus, a classic part of Schoen complex. Some consider this to be an acquired lesion resulting from the turbulent flow across the mitral valve. Parachute mitral valve, all chordae tendineae insert into a single dominant papillary muscle. Though this is the least common form of congenital mitral stenosis, it is discovered the most frequently as a de novo diagnosis in the adult population. Congenital mitral stenosis is frequently a component of Schoen complex, a series of obstructive lesions on the left side of the heart. Supramitral ring, parachute mitral valve, subaortic stenosis, and coarctation of the aorta. Severity of symptoms depend on the degree of obstruction and the presence of associated shunts like atrial septal defect, which can decompress the left atrium. Tachypnea, poor feeding, failure to thrive, and recurrent pulmonary infections due to pulmonary venous congestion. Loud S1 and an apical mid-diastolic rumble can be heard. Unlike rheumatic mitral stenosis, an opening snap is usually absent because the leaflets are thick and non-pliable rather than fused at the tips. Signs of right ventricular hypertrophy, that is left parasternal heave or RV heave, if pulmonary hypertension has developed. Echocardiographic assessment focuses on Simpson's biplane method for volumes and specific Doppler hemodynamics. Mean pressure gradient across the mitral valve is elevated, often more than 5 to 10 millimeters of mercury, indicating significant stenosis. Pressure half time is used to calculate the mitral valve area